Assalamu alaikum. We'll talk today about the heart. The heart is composed of 4 chambers, receiving 2 chambers which are located superiorly, the atrium, right atrium and left atrium, and the 2 ventricles, the right ventricle and the left ventricle. The heart anatomically has apex and the base, anterior surface and inferior surface, and the right and the left surfaces. Where is the apex of the heart? The apex of the heart, this is the apex of the heart. And as we know, the apex is opposite the base. This is the base of the heart and this is the apex. The apex is located below and to the left. So it's formed by left ventricle. And the apex of the heart is the site of mitral valve auscultation. The base of the heart, this is the base of the heart. The base of the heart is formed by 2 atria, but this is the left atrium and this is the right atrium. So the left atrium is formed, or the base of the heart is formed mainly by the left atrium. This is the anterior surface. The anterior surface is called sternocostal surface because it is related to sternum and ribs. It's formed by ventricle and 2 atria. The ventricle, the right ventricle here, composes about 2/3 of the sternocostal surface, and the left ventricle composes about 1/3 of the sternocostal surface. Now we have this surface, my hand like the diaphragm, so this surface is called diaphragmatic surface. The diaphragmatic surface is composed by the 2 ventricles, but mainly the left ventricle. The left ventricle composes about 2/3 and the right one is 1/3. So the sternocostal surface is 2/3 for the right ventricle, but the diaphragmatic surface is only 1/3 from the right ventricle. We have also this surface which is called right surface, which is composed mainly by the right atrium, and this surface called left surface, which is composed mainly by left ventricle. What blood vessels, or what are the blood vessels go inside and outside the heart? We have this one, this is the superior vena cava, which enters the right atrium, and we have the inferior vena cava, which enters also the right atrium. The right ventricle, the pulmonary trunk arises from the right ventricle, which is divided into left and right pulmonary artery. There's the right pulmonary artery and this the left one. This is the aorta. This is the ascending aorta, which gives the arch of aorta. The arch of the aorta gives 3 branches. From the left side, left subclavian, left common carotid, and the brachiocephalic artery, which will divide it into 2 branches, right subclavian and right common carotid. Here, in the right, so the left atrium receives 4 pulmonary veins, 2 left pulmonary veins and 2 right pulmonary veins. What are the blood vessels enters and exit from the heart? This is superior vena cava, which drains the blood from the upper half of the body into the right atrium. Vena cava, which drains the blood from lower half of the body into the right atrium. The deoxygenated blood enters the right atrium, which pumps the blood into right ventricle. The right ventricle pumps the non-oxygenated blood into the pulmonary artery. This is the pulmonary artery, which is divided into 2 arteries, the left pulmonary artery and the right pulmonary artery. The blood oxygenated within the lung and returns again to the heart through the 4 pulmonary veins. This is the 2 left pulmonary vein and this is the 2 right pulmonary vein, which conducts the oxygenated blood from the lung to the left atrium. The left atrium pumps the blood to the left ventricle, which pumps the blood through the arch of the aorta. This is the ascending aorta, then arch of aorta. The arch of aorta has 3 branches. This is the left subclavian, this is the left common carotid, and this the brachiocephalic artery. Now, this is the ascending aorta. Give branch called right coronary artery this, to supply the heart. The right coronary artery curves around the heart, curves, and give here branch called posterior or inferior interventricular artery, then anastomosis with a branch from left coronary called left circumflex artery. Here, this is a small artery called left coronary, which divides into anterior interventricular artery and left circumflex, which curves around the heart to meet the right coronary artery. This groove called the coronary sulcus, which divides the 2 atria from the 2 ventricles. The coronary sulcus contains coronary sinus, this is the coronary vein of the heart, or venous, carries the venous blood of the heart, and also contain the right coronary and the left circumflex branch of left coronary. This groove is called anterior interventricular groove, contain anterior interventricular artery branch from left coronary, and this vein is called great cardiac vein. This groove is called inferior interventricular groove, which divide or passes between the 2 ventricles. The posterior inferior interventricular groove contains artery called posterior interventricular artery branch from right coronary and middle cardiac vein. This is a plastinated model. This is the right atrium, and this small area is called right auricle. This is the right ventricle, this is the left ventricle, and this is the left atrium, and this the left auricle. The heart has apex, which is composed of left ventricle, and has a base, which formed by 2 atria, mainly the left atrium, and has anterior surface or sternocostal surface. The sternocostal surface is formed by 2 atria and 2 ventricles, but the right ventricle composes about 2/3 of the sternocostal surface, and the left ventricle shares by 1/3 of the sternocostal surface. This surface is the diaphragmatic surface. This is the diaphragmatic surface. The diaphragmatic surface is also composed of 2 parts. This the left part and this the right part. The left part is larger than the right part and composes about 2/3 of the diaphragmatic surface, and this the right part composes about 1/3 of the diaphragmatic surface. We have right surface, which is formed by right atrium, and left surface, which is formed mainly by left ventricle. What about the blood vessels? This is the superior vena cava, which opens into the right atrium. And from here, this is the inferior vena cava, which opens also in the right atrium. This is the pulmonary trunk, arises from right ventricle and divides into this is the left branch or left pulmonary trunk, and this is the right pulmonary trunk. This is the aorta, this is the ascending aorta, and this is the arch of aorta. The arch of aorta has 3 branches. This one left subclavian, this one left common carotid, and this one brachiocephalic artery. This is the left atrium, which receives 4 blood vessels. There's 2 left pulmonary veins and these 2 right pulmonary veins. The left coronary is very short artery, which gives branch here is called anterior interventricular artery, which is accompanied by great cardiac vein. It also gives branch called circumflex or left circumflex artery, which curves around the heart and anastomosis with the right coronary artery. Here is the coronary sulcus, which contains the coronary vein or coronary sinus, which carries the venous blood of the heart. This is the right coronary artery, which curves around the heart. Okay, and gives here the posterior interventricular artery. If we look for this heart, this is the right coronary artery, which arises from ascending aorta and curves around the heart, the right side, and give here branch called posterior interventricular artery. We have very small artery called left coronary, which has very short stem, which divides into two branches. This one, the anterior interventricular, and this one, the left circumflex artery, which winds around the heart to anastomose with right coronary artery. It gives branch here called left marginal, which supplies the left ventricle to the apex. The anterior interventricular artery accompanied by vein is called great cardiac vein, and the posterior interventricular artery is accompanied by a vein called middle cardiac vein. This vein is called coronary sinus, which passes in the coronary sulcus.